fungi can be harmless or can create havoc, especially in vulnerable patients. Treating them isn't as simple as killing bacteria. Why? Because fungi are eukaryotic cells similar to human cells. So finding the right target without affecting the human cells, the host cells, can be tricky. In today's video, we will decode some of the powerful antifungal drugs that are used for the treatment of fungal infections, how these drugs work, and why understanding these mechanisms is essential for effective treatment. Let's see some of the common fungal infections in clinical practice. They can be divided into superficial, subcutaneous, and systemic or invasive infections. Examples of superficial infections are dermatophytosis, such as tinea infections, tinea corporis, capitis, pedis are some of the examples of superficial infections. Candidiasis, for example, oral thrush or vaginal candidiasis are examples of superficial infection. An example of subcutaneous infection is sporotrichosis. So sporotrichosis is an example of subcutaneous infection. Some of the examples of systemic or invasive infections are histoplasmosis, blastomycosis, cryptococcosis, aspergillosis, candidemia. The currently available antifungal drugs have unique cellular targets. So this is a figure which shows the targets for drug action. The first target is the nucleic acid synthesis inhibition. Antifungal drug known as 5-flucytosine or 5-fluorouracil inhibits nucleic acid synthesis. By inhibiting DNA and RNA synthesis, they inhibit the fungal genetic replication. The second target is microtubules. Antifungal drug known as grisofulvin binds to microtubule associated protein, thus inhibiting cell division and mitosis. The third target is ergosterol, which forms an important component of cell membrane. So ergosterol forms an essential component of fungal plasma membrane, and this helps in maintaining the integrity of the plasma membrane. Now there are drugs that bind to ergosterol in the plasma membrane and forms pores and channels in the membrane, causing leakage of ions and molecules, and because of intracellular leakage of ions and molecules, there is fungal cell death. So polyenes, a class of antifungal drugs which includes amphotericin B and nystatin, directly binds to ergosterol, causing death of the fungal cell. There is another class of antifungal drug which is known as allylamines and benzylamines, and this group of drugs inhibits the enzymes that are responsible for the formation of ergosterol. So ergosterol is synthesized in the endoplasmic reticulum and forms an important component of the plasma membrane. The next target is cell wall. Fungi have a rigid cell wall which is composed of chitin and beta-glucan, and beta-glucan is synthesized by beta-glucan synthase. So echinocandins, a class of antifungal drugs, inhibits the synthesis of beta-glucan, which forms a component of cell wall by inhibiting beta-glucan synthase. Let's now learn about the classification of antifungal drugs based on the mechanism of action. The first one is inhibitors of fungal mitosis. The drug is grisofulvin. So grisofulvin binds to microtubule associated protein, disrupting the mitotic spindle, inhibiting cell division and inhibiting mitosis. It treats fungal infections of skin, hair and nails. This is because of the characteristic property of grisofulvin. It accumulates in the keratin precursor cells. It binds tightly to differentiated cells such as skin, hair and nails, and because of the tight and prolonged association of grisofulvin with these cells, the new growth of skin, hair and nails is free from infection, is free from dermatophyte infection, and therefore grisofulvin is useful for the treatment of infections of skin, hair and nails. The next class of drug is inhibitors of fungal nucleic acid synthesis. That is the drug known as 5-flucytosine, which enters into the fungal cell via transporters known as cytosine permease transporters. So these transporters help in the entry of this drug into the fungal cell. Now do note that human cells lack these transporters and therefore they are protected from the effects of the drug. The drug upon entry into the fungal cell gets converted to 5-fluorouracil and after conversion it inhibits thymidylate synthesis enzyme. So because of the inhibition of thymidylate synthesis enzyme, deoxythymidylate formation is inhibited, DNA and RNA synthesis is inhibited, and this inhibits the fungal genetic replication. The third class is inhibitors of fungal membrane stability. As I have mentioned, ergosterol, a key component of the fungal plasma membrane, which helps to maintain the stability of the plasma membrane. Now, a class of drug known as polyenes, and it includes amphotericin B and nystatin. So, these are the two drugs that directly bind to ergosterol, forms channels, forms pores in the membrane, and causes leakage of cellular contents and causing death of fungal cell. The next class is inhibitors of ergosterol synthesis. Ergosterol is synthesized in the endoplasmic reticulum and is mediated by certain enzymes. There are antifungal drugs that inhibit various enzymes that are responsible for the formation of ergosterol, thereby inhibiting its synthesis. So how is ergosterol synthesized? Acetyl coenzyme A is a building block. It forms squalene, which is an intermediate, and squalene in presence of squalene epoxidase gets converted to epoxide and lanosterol. So squalene gets converted to lanosterol in presence of squalene epoxidase, and this enzyme is inhibited by another class of antifungal drugs which is known as allylamines. So allylamines inhibits squalene epoxidase enzyme, inhibiting the conversion of squalene to lanosterol, and the drug is terbinafine. Now once lanosterol is formed, lanosterol gets converted to ergosterol in presence of 14-demethylase. So lanosterol 14-demethylase catalyzes the conversion of lanosterol to ergosterol, and there is a class of antifungal drug which is known as azoles, and this class of antifungal drugs inhibits demethylase enzyme, thus inhibiting the final product, that is ergosterol synthesis, and this causes disruption of the plasma membrane and death. Azoles can further be subclassified as imidazoles, which include topical agents such as clotrimazole, iconazole, miconazole. Systemic imidazoles include ketoconazole. Now, triazole includes antifungal drugs such as fluconazole, itraconazole, voriconazole, and posaconazole. So, these are some of the antifungal drugs that are included as triazole. The next class of antifungal agent is inhibitors of fungal cell wall synthesis. Fungal cell wall is composed of beta-glucan, which provides structural support and rigidity. There is a class of drug known as echinocandins, which includes caspofungin and micafungin. They inhibit the synthesis of beta-glucan by inhibiting an enzyme known as beta-glucan synthase. So beta-glucan, which is an important component of cell wall, is inhibited, the formation is inhibited, and the class of antifungal drug is known as echinocandins, which includes micafungin and caspofungin.